Hello everyone, my name is Suparna Sharma and the topic of my paper is ambulatory or outpatient care. Okay, so let's look into the definition of an ambulatory care or an outpatient care. Ambulatory care or outpatient care is defined as the medical care provided to a patient in a clinic, a hospital, outpatient department, health department, a physician's clinic, or an urgent care clinic that does not require an overnight stay. Medical services provided on an outpatient basis include diagnosis, treatment, observation, consultation, and rehabilitation. Some of the specialty ambulatory care centers are OBGYN, pediatrics, and ambulatory surgery centers. There are numerous ambulatory care centers or outpatient care centers in and around Gainesville. It was not possible for me to list each and every one of them because due to space restriction on the paper. So I try to include different types of outpatient care in my examples. For example, for internal medicine, we have UF Health Internal Medicine, SciMed, then there is Gainesville Internal Medicine Physicians. For OBGYN, we have Gainesville OBGYN, North Florida Women Physician, and then for urgent care, there is Emergency Physicians Medical Center, and Orthopedic Institute is a specialty outpatient clinic. All of the ambulatory care centers or the outpatient care centers are regulated by state and federal laws. Some of the laws that I thought were relevant for the HIM professionals are listed below. First of all the ambulatory surgery centers requires a state license. Then in case of a physician terminating or relocating practice, the law says that each and every client or a patient of the practice should be notified. This notification shall be published in the newspaper and it should contain the date of termination or relocation and an address at which medical records may be obtained. Such notice shall be published no less than 4 times over a period of at least 4 weeks. Second relates to the death of the physician. So, in case of a death of the physician, an administrator or an executor of the clinic shall keep the records for 2 years in their custody. They must publish a notice in the newspaper about the death of the physician and about the location of medical records of their patients. At the end of 22 months, the administrator or the executor must publish another notice about the details of the location of medical records. The notice should appear once a week every 4 consecutive weeks. Any unclaimed records shall be destroyed 1 month after the end of that 2 year period. So this slide shows some more rules and regulations. First one is about the release of information. A written authorization from patient or their legal representative is required for any release of information, but medical records may be furnished without written authorization only under the following circumstances: for providing treatment and reimbursement, when law in any civil procedure required a physical exam, then we have to share the results of that exam with whoever ordered it. Upon the issuance of subpoena in a civil or criminal case for scientific and statistical research to a regional poison control center for purpose of treating a poison episode. The next one is under Florida law, Florida statute number 458.331, All physicians must retain the medical records for 5 years after the last encounter. And the pediatrics record must be kept until the child reaches the age of 18. So now we come to the documentation requirements at an ambulatory care center or an outpatient care center. First one, the required documents at an outpatient care centers are registration form, history questionnaire, problem list, medication list, history and physical, progress note, consultation report, diagnostic test results, immunization record, records from previous treatment, consents, and advance directives. Required medical documents at an ambulatory surgery centers are patient identification, history and physical, preoperative diagnostic, findings of all pathology reports on all tissues removed during the surgery, any allergies and abnormal drug reactions, entries related to anesthesia administration, documentation of properly executed informed patient consent, discharge diagnosis. Okay, now we come to the reimbursement for outpatient clinics. Center for Medicare and Medicaid, that is CMS, uses physicians' fees schedule, that is PFS, to pay physicians for their service in an outpatient facility. CMS uses outpatient prospective payment system to calculate the payment. Under this method, the payment under this method is based on relative value unit, that is RVU. So RVUs are applied to each service for physician work, practice expense, and malpractice. And CMS has this formula and they calculate and they pay the physicians. Other insurance companies like Blue Cross Blue Shield, AvMed, or United Health, they provide different choices of insurance plan to their members like PPO, HMO, and EPO. And they have different ways of paying for their services. Under HMO plan, physicians get paid a set amount of money per head for the number of patients they have for the entire term of coverage. Some of the accrediting agencies for an outpatient or ambulatory care centers are Accreditation Association for Ambulatory Healthcare, that is AAAHC, the Joint Commission, American Association for Accreditation of Ambulatory Surgery Facilities, that is AASF, Healthcare Facilities Accrediting Program, that is HFAP. The coding scheme used at an ambulatory or outpatient care center is the code sets used are CPT, HCPCS, and ICD-10-CM. ICD-10-CM is used for reporting diagnosis, while CPT and HCPCS are used for reporting procedures and supplies. The primary use of these codes are, of course, for treatment, continuity of care, and reimbursement. The secondary use for these codes are for research, education, and policy making. So now we come to the sample of a policy and procedure document for creating a new medical record. And this is the example which I created for the purpose of this paper. It has, of course, the title which says Policy and Procedure for Medical Records, the date it was created, and it is approved by the management, and the date of revision. Purpose is to establish the guidelines for contents, confidentiality, and maintenance of patients' medical records in accordance with federal and state requirement. Scope: these policies apply to all employees of Goodwill Clinic, and the policy is Goodwill Clinic ensures that patients' protected health information is documented and maintained in a manner which corresponds to federal and state regulations and ensures timely and secure access by the physician at the time of patient encounter. Privacy and security of medical records is maintained in accordance to the HIPAA law. Procedure for creating a new medical record at the time of admission. First is an individual record must be created at the time of admission of a new patient, and following must be entered into the record. For that, we have to go to the next slide. Okay, so this slide shows us the elements that should be present in a medical record. There were two on the previous slide, which were demographic and insurance information, and then there is past medical history, social history, medication history, current medications, allergies, immunization history, consent to disclose information, advance directive, and then there are policies regarding the timely completion of medical records. The medical record must be completed within 10 days of discharge. Late entries should be signed and dated as late entry. Clinic license requirements state that record must be completed within 10 days of discharge. Physicians who fail to do so will be subjected to suspension of the clinical privileges. Entries into the medical records can only be made by medical staff, nursing staff, and allied health professionals directly involved in patient care. And then we have next slide. This concludes my presentation on ambulatory care center or outpatient care center. These are the references that I used to write my paper and to get information regarding the outpatient care. Um, and please let me know if you have any question. Thank you and have a very good day.